Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue Salt Therapy, Part 29, Sulph-1. Full name, Kalium sulphuricum. Short name, Kali-Sul or Kali-Sulph. Chemical name, potassium sulphate. Mode of action. Feeling choked in closed room and craving for open cold wind are two chief symptoms which indicate want of Kali-Sulph in the system. Please remember these two symptoms. This symptom will be present in almost every disease condition which require Kali-Sulph. There are about 70 lakhs of hair follicles. This is the hair follicles actually. Hair follicles on our skin. In healthy condition, fine jet of water vapor comes out of the pores of the follicles. Note this, the fine pores. This is the fine pores lying in the root of these hair follicles. And there are also glands just draining their excretory product through this opening. So this vapor contains excretory products naturally because this glands expires through these pores. Want of Kali-Sulph hampers with normal functioning of these pores. This normal functioning of this pore, these 70 lakhs hair follicles, if these pores function with the help of Kali-Sulph, if Kali-Sulph is depleted, then this excretory function of the pores is disturbed. Excretory product accumulates in the skin, in the system, and causes the disease condition. This is the most important thing about Kali-Sulph that you must remember. There must be some trouble on the skin surface through where the pores are not acting healthily, which should be. There is functional difficulties of this pores requires Kali-Sulph. This is the most important. You must remember this thing. General action of Kali-Sulph. In the late stage of an acute disease, late stage means third stage of an acute disease, when disease gravitates and gradually tends to wear out, the inflammatory exudate becomes heavy yellow greenish, then Kali-Sulph shows its excellence. Kali-Sulph shows its action mainly on epidermis layer of the skin. It arrests damage to the epidermis of the skin. When a disease is caused by suppression of skin disease or cessation of natural perspiration, Kali-Sulph restores health in retrograde action. Kali-Sulph for mental aberration. Number 1, timidity. Number 2, hasty in all actions. Number 3, worsen mental effort. Number 4, irritability. Number 4, fearful of falling down. Number 6, anxiety in evening. Number 7, depression from suppression of skin disease. These are the mental symptoms of Kali-Sulph. Kali-Sulph for scalp and head symptoms. Profuse dandruff on scalp. Use externally too. That is, when you give this medicine for dandruff, for oral intake, you can also instruct your patient to use it in the external area, mixing with, say, olive oil or glycerin or Vaseline like things. Then the cure will be faster. In this case, for this type of symptom, natamur, NM means, you note this thing, NM, natamur for natamur, for the same symptom, natamur can be used. Dandruff adheres to wet hair. Hair falls off, baldness appears, eruption over scalp, thin sticky exudation over scalp. All this thing has been demonstrated in through these pictures. Headache worse in warm closed room, in evening better in open cold air. Rheumatic headache worse in evening, better in open air. Kali-Sulph for eye symptoms. Watery, yellowish green, yellowish or cianous secretion from eye or eyelid. Yellowish scab on the eyelid, thick pus from stye thick pus from stye, thick secretion from conjunctiva. This from conjunctiva. This is conjunctiva, red conjunctiva. Thick secretion therefrom. Cataract with opacity of lens. This is here natrium is also useful. Kalisalp for ear symptoms: earache with yellowish watery discharge, piercing earache, deafness with watery exudation from inflammation of ear, throat, eustachian tube, deafness, swelling of internal ear, mind it, swelling of internal ear, most serious thing, with yellowish or greenish discharge, worse in worm stuffy room, polyp in ear canal. This is ear anatomy is shown here. This is external ear. This is middle ear, malleus incustipis and the eustachian canal, and this snail-like structure and other semicircular things is called internal or third part of the ear. Calibrate for nose symptom: thin, sticky, yellowish or watery mucus, worse in warm closed room, use after ferrum phos. That is, in this situation, you first use ferrum phos, then Kalisalp in combination. If it fails to perspire and skin remains dry, use after FP. If it fails to perspire, that is, you have applied FP, ferrum phos, but there is no perspiration, skin remains dry, then you use this and you will get the result. Nose blocked, yellowish or greenish yellow exudation from posterior nares. Posterior nares means the back side of nose, where the nose opens in the pharynx area. This is external opening, anterior nares. This is posterior nares. It is in line with this pharynx, ultimately throat. Yellowish, greenish yellow exudation from posterior nares. Loss of smell, ozina, nasal polyp. Similarly, ear canal polyp, there may be nasal polyp also. And loss of smell and ozina, ozina is a destructive disease of nose. Destructive disease of nose whole structure, the mucous membrane, the bony structure is destroyed. It's very obnoxious and disturbing type of disease. Nowadays it is very little seen, but it was a very tough disease, and it was thought that it is an extension of third stage of syphilis. Third stage, in this third stage of syphilis, these symptoms appears. This destructive disease. Kalisalp for facial symptom: neuralgic pain, come off and on, moves about, troubles worse in the evening or in warm room, better in cold open air. This is always there. Worse in evening warm room and better in cold open air. It is always there. It is a characteristic, the most guiding symptom of Kalisalp. Features: face pale, feature distorted. Epithelioma, cancer of the mouth or nose, is called epithelioma. These are the pictures of epithelioma, cancer of nose or mouth. Kalisalp for mouth symptoms: swelling and dryness of lower lip, peeling off of big flakes. See the structure. Edge of tongue white, tongue, lip, gum, all are white. No taste in tongue. There is no taste in tongue. This is very rare symptom. It is available. We can get this in Kalisalp. Kalisalp for tooth symptoms: trouble worse in the evening and closed room, better feeling in cold open air, chronic pain in gum. This symptom, worse in evening closed warm room and better feeling in cold open air, is a guiding symptom of Kalisalp. Mind it. Kalisalp for throat symptoms. This symptom, trouble worse in the evening closed room, better feeling in cold open air. This is I mentioned personally, and I am giving too much pressure on it. This is a very characteristic symptom of Kalisalp. Kalisalp for throat symptoms: throat dry as if constricted, phlegm comes out of throat, swollen tonsils, deglutation difficult. To alleviate snoring and mouth breathing due to swelling of nasopharyngeal mucosa after tonsillectomy. Tonsillectomy, this is a modern medicine treatment. Actually, it is surgery. After this surgery, this trouble comes. The patient cannot breathe through nose, So he performed mouth breathing, and there is severe snoring during sleep. So this medicine, Kalisalp, then helps such patients. Kalisalp for circulatory organs, nagging pain over iliac crest. This is iliac crest. There is a nagging pain on this crest. Pulse very feeble, palpitation all over body. This nagging pain over iliac crest, you see, this is a very troublesome symptom, and it requires, and this is actually third stage of inflammation. Inflammation when this this disease, this is called femur, where femur joins in the pelvis, that joint, femur joint. The same thing appears here. Here is a very nagging pain on the joints. Same, Kalisalp. This is posterior nair, and this is anterior nair nose. The frontal opening is called anterior nair. The posterior opening in the pharynx is called posterior nair. This is posterior nair. These are the two tonsils or swollen. It is already some reference is there. Please correlate.